All right. So this is our Hilo Medical Center's health clearance form. It is still in a draft process. However, we're going to take all of the health record information that we get from our applicants for our EMS programs, both the EMT and paramedic, and any one of those the in between and outside of that. We're going to take that health screening information that they've got and take into their medical provider. So they're going to have the documentation that shows that they've taken the immunization at a particular point in their lifetime. It was given by a medical professional. That medical professional recognized that they gave it to that individual, the location that that shot was given, the amount that was given, possibly a reaction or non-reaction that was given, and these things are written down in immunization record. That records were then taken to their primary care physician, their healthcare provider, their medical professional to have it evaluated, commented on, and then recorded onto another document, as which is called the screening documents. This could be for Hilo Medical Center or for our general application to Kapilani Community College. So it had to be done, and they had to have gone to see their physician. So now what we're doing is we're taking a look at that document, and we're going to start filling in some information. I like to print this out and then do a hard copy on paper and just write these things out because it can be cumbersome. So as we fill in the names, we can look at when we're going to start. The reason why we have these clinical dates is so that we can make sure that while this information is being put in, some of it may be irrelevant by the time we start our clinical setting, which means that we probably have to redo the immunization or redo the test that is required. And so that's the reason why we're putting it in here. And then the end date gives us an idea of when we're starting, when we're not, when we're ending. It also helps the hospital to know, if they're clearing these students, that they can also verify that during the time that the students will be in the clinical site, that they are protected against some of these pathogens because they've been inoculated and have the immunity to it. Okay, so here's our TB. If we look under this heading, we're going to look at TB clearance. What we really want is the two-step. And the two-step should be have done, and when it's done, it's good for that 12-month period. If they are falling outside that 12-month, then we're going to require them to have at least another one-time skin test to be done. This can also be used as what's called a TB Gold. So just make sure when they're doing it, just find out if they're going to do the PPD skin test or they're doing some other kind of documentation. If the result of a prior skin test resulted in a positive result, where the skin, when they recorded it, it was much bigger than a negative result, and it made it a positive skin test, then we need the date of that positive skin test. And then they're going to have a chest x-ray that shows, that chest x-ray is going to be read by their medical provider, a healthcare provider, or a doctor, primary care doc. It's going to say that they don't have any disease that they can see on the x-ray, and then as well as um, they're not having any symptoms. So this is where we would put in the TB steps. The two-step, if it's not validated or it's outside of a year, then we'll have to have the single step done as well. And if there's a positive, then when was a positive done, and then the x-ray. On top of that, they're also going to fill out a questionnaire. It is for tuberculosis screening. They're going to fill that out and then they'll just sign that. Okay, so it continues down either two-step here, or then after we get the two-step recorded somewhere in here, then we'll put it down in here. Or if there was a positive test, then we want to have the retest or the chest x-ray that's done, and then their questionnaire. So that's why we have this kind of broad open category. We're going to move down to the measles, mumps, and rubella, MMR, and varicella. So on the Hilo Medical sheet, it's all on the same page. But the first three, they need to have these. What's going to happen is that they're going to have two sets because MMR is given in a single immunization. And so they're probably going to have two sets. They have to have the two dates. So two dates that go across when they received it the first time, and then a second set put in when they were received the second time. Now, if they've gone ahead and had the two series and they decided with their medical provider or healthcare provider, they've had titers done, the titers will either say reactive or positive, which means they have the immunity, non-reactive or negative, which they means that they do not have the immunity and is going to be required to then be revaccinated, or unequivocal. And again, we probably would have them have the revaccination done. And here, again, these are done in a one time vaccination or inoculation. So they're just going to have it again if they do not have positive titer or they do not have the two dates where they've done these series step one and the step two, or series one and series two. Varicella, it's another type of vaccination. They're going to have two dates again here in which they took this. Again, if they went and had their titer done, we usually do the titers for MMR, varicella, and uh, hepatitis B. So if they had their titers and their titers, this means that they've taken the series of vaccinations and they've tested to see if they had it in their blood. So they have an immunity by having a blood test done. It would say positive or reactive, and we would place it in here. Now, if it's negative or unequivocal, we can put that down here, or you can put that down in the comments. Again, when it's negative or unequivocal, then we're going to want them to have the immunity, which may require them to have a booster done for, again, MMR and varicella. When it comes to hepatitis, the hepatitis is a 3 series. The first 1 month later, and then within the 6 months, they have to have the third immunization done. We place the 3 dates down, and that can be put down in the comments or somewhere else. But if they have a positive titer, then the positive titers go all in here. If there's a negative or unequivocal, you put it in here, and in the comments you can put down when they took the series. But it's more than likely they're going to have to take the vaccination or get re-inoculated. Here we're looking at our tetanus, diphtheria, and pertussis, and tetanus toxoid. So they're going to need to have one for here, and then we need to have these two steps done here. Tetanus, we'd like to have those every 10 years. So if it's great, less than 10 years, then they're great. If it's over 10 years, we may have to get re-inoculated there. We want them to be immunized for the flu, the trivalent strain. Well, so we're looking at hopefully trying to get this done and annually. So we want this to be up and current. If not, they're going to have to sign a waiver and they'll have to wear a mask. And it just makes things much more complicated. So if we can just get them to have this vaccination done annually. There are a few other pieces of information that they're going to be submitting when we're doing this health screening. We're going to need to have them complete the immunization record that we went over earlier with all the supplemental information. That record is going to have to be signed by that medical professional or provider or primary care physician that verified that these immunizations were done. They're going to fill out a latex allergy questionnaire. They're going to fill out hepatitis B form questionnaire. They're going to also fill out an annual TB skin questionnaire. And they also have to fill out a respiratory fit test for the N95 type mask. If we are not screening them on our own side, they're going to have to pay for this to be done at the Hilo Medical Center. That will be an additional cost. Additionally, to the health clearance is a background and drug screening check. So there's forms for both the background and drug screening. There's a fee for this. It's going to be $100. They'll also have to fill out a parking pass in which they are going to need their registration as well as insurance information for the vehicles that they'll be using and parking while on the campus at Hilo Medical Center. And they'll finally be given, we're going to need their emails, phone numbers, and their um, contact information so that the drug screening can be performed and the background checks can be performed. They're also going to need their names, their phone numbers, and their emails, that contact information for a health academy. This is an online program, online course that is required for all individuals, agencies, departments that are going to be entering Hilo Medical Center. It's a requirement. So this online academy, this health academy, is quite robust and condensed. It's going to take some time for them to complete this. This is an online series. Completion gets sent to the HR office. And if they do not complete all of these records and forms, and the health academy will not be allowed to attend. Okay, big notice here. Anybody that misses the drug screening or has a hot test is not going to be allowed to go into the hospital. Second thing, if there's anything on the background check that flags or comes up, you'll not be able to go into the hospital. As a result, you won't be able to complete the clinical rotations or clinical experience, and that's going to preclude you from continuing on in any of the EMS programs that require you to attend a clinical site. So what does that mean? It means that that's it. The course is done for you at this point. We'll try to work with you to see what can be done, but more than likely, we'll start the disenrollment process because you won't be able to participate in the clinical portions. I will go ahead and take any questions right now, and we'll start looking at the information that we have for each student.